Good evening. Welcome to the Multi-Ministerial Task Force press conference. On our panel today, we have Minister for Trade and Industry, Mr. Gan Kim Yong, Minister for Finance, Mr. Lawrence Wong, Minister for Health, Mr. Ong Ye Kung, Minister for Transport, Mr. S. Iswaran, and Director for Medical Services, Professor Kenneth Mak. May I now invite the panel to begin with a few words. Minister, please.
Thank you. Good afternoon. There's been about 2 weeks since we entered the preparatory stage of our transition to COVID-19 resilience state. Since then, the number of COVID-19 infections and unlinked cases in the community have been stable, and the number of serious cases has not surged, and our healthcare system remains adequate. The vast majority of the death cases were among the unvaccinated, especially among the elderly. Vaccination, therefore, remains key to our defense against COVID-19. We are also making good progress in our vaccination program. As of 17 August, 77% of our population has received 2 doses of COVID-19 vaccines. In particular, we are very pleased to see the vaccination rate has gone up significantly to 85% among our seniors aged 60 and above. If all goes well, we will be on track to vaccinate 80% of our population with 2 doses by early September. We will therefore proceed with the relaxation of the SMM measures that we announced earlier. With the COVID-19 situation here coming under control, we can also start to take steps to carefully reconnect Singapore with the outside world, and we need to do so. We have tightened our border measures over the last 1.5 years to allow us to gain control over the local situation. But this has a significant impact on our lives and our livelihoods, as well as Singapore's long-term competitiveness and attractiveness as an investment destination. Many sectors of our economy require a steady flow of people in and out of Singapore, be it workers or visitors. These include construction, marine, and the services sector too. Many regional and global businesses operate out of Singapore. Their executives, many of them locals, need to travel to manage and grow their businesses. Many foreign businessmen also need to come to Singapore to do business with us. It is also not just about the economy. Many tertiary students want to go for their overseas studies, attachment, and internships. Singaporeans are also waiting for their domestic helpers to come to Singapore to help them. Some Singaporeans may also have family members who are yet unable to return because of our tight border control measures. When we achieve 80% coverage by early September, we will be able to progressively reopen our borders. We have established a framework to do so. We will calibrate our border measures and introduce vaccine-differentiated arrangements for travelers from countries that are able to control their infection and have good vaccination rates. To guide our border measures, we will classify countries into 4 categories. Each of these categories will have its own set of border measures based on the assessed risk level of that category. Firstly, this first category is basically very safe countries. We have offered unilateral opening to some of these countries and places already with very little problems. Second category are countries which are of similar risk level as ourselves. We have been allowing them to be SHN from home for 7 days without much problem. As countries vaccinate, their infection rates come down. We are also seeing more countries being allocated to this category. The third category are countries that are below our risk level. They will be subject to 14-day SHN, but for those fully vaccinated, as we have previously announced, we will allow them to do SHN at home if their homes are found suitable. Finally, there will be countries with high risk in the category 4, which will still have to serve 14-day SHN in dedicated facilities. And a few of them are still on the NTL, not to land list. At the same time, we will also introduce a new vaccinated travel lane arrangement for countries, particularly in Category 2, starting with Brunei and Germany as pilots, where fully vaccinated travelers will undergo frequent PCR tests in lieu of the Ascertain requirement. This will provide greater flexibility for the vaccinated travelers and facilitate their visits to Singapore and for Singaporeans to return. If the pilots are successful without causing a surge in the number of severe cases or mortality, we can gradually extend the scheme to other destinations. Minister Iswaran will elaborate more on the new border measures later on. In addition, we will recognize overseas vaccinations for access to local venues, facilities, and events. Travelers whose vaccination status is verified upon entry will be eligible for vaccine-differentiated SMMs. Even as we gradually resume more economic and social activities and open our borders, we will need to do so carefully and avoid a big bang opening, which may lead to a surge in infection cases that could put our healthcare system under stress or lead to high mortality. This step-by-step approach will allow us to respond quickly if the need arises. As we move into Stage A with border opening, we are taking a step closer to being COVID resilient and living with COVID-19. We must keep on pushing vaccinations, ensure compliance for SMMs in the community, calibrate our opening carefully to avoid a major surge that could threaten our system and cause us to lose control over the pandemic. I would like to take this opportunity to thank Singaporeans and businesses for your support as we continue our journey towards a COVID-resilient state. Let us work together to get there safely. Thank you. I'll now invite Minister Ong Ye Kung to say a few words.
Thank you. I think everyone is eagerly waiting for the elaboration on border measures. But bear with me and DMS Professor Kenneth Mark as we give three updates. Number one, the COVID-19 situation in Singapore. Number two, our vaccination exercise. And number three, a very important initiative to allow fully vaccinated infected individuals with no or mild symptoms to recover at home. Let me start with the COVID-19 situation. In short, the situation has been stable. In fact, I've been very heartened. Last week, we allowed restaurants to open with a maximum dining group of 5, and it's been more than a week now, and cases are actually on a downward trend. And shortly, we are announcing today's numbers. I think it's in the 30s. I think this is great news for the industry because it means when we have a high rate of vaccination and then we implemented vaccination differentiated SMMs, we can keep transmission under control while restaurants are open. And I think this gives greater assurance to the F&B industry that the outlets can remain open. There has been concern about the recent spate of COVID-19 related deaths. In fact, that was what the MTF, we were very concerned about when the JFP, the Jurong Fishery Port Cluster, first broke out and then spread to different wet markets around Singapore. So that cluster now comprises more than 1,000 people, including many unvaccinated seniors. So we look at the numbers. Every day when you look at our press release, we show you the ICU numbers, which is a stock figure, the number of patients in ICU for that day. But we took a look at the flow figures. So over the last 21 days, that is 29 July to the 18th of August, we had 8 deaths, 7 of whom were unvaccinated seniors. So in hindsight, it was a correct decision to throttle back to phase 2 HA when the Jurong Fishery Port Cluster first broke out. Fortunately, we did that. Otherwise, I think there will be many more deaths. So that move, I think, saved many lives. So the positive news now, when we look at the flow numbers of ICUs, is that admissions to ICU is on the downward trend. As cases come down, more people get vaccinated, we see that admissions into ICU is coming down. So the last 21 days, altogether there were 19 admissions into ICU. So the first week, there were 9. Second week, there were 7. And the third week, which is the past 1 week, there were 3. So it's coming down steadily, and let's hope we can keep that number down to a minimum as more people get vaccinated. Now, let me move on to the second topic, which is vaccinations. As of 17 August, 77% of our population have completed their full regimen. 82% have received at least 1 dose. That is quite significant, which means sometime in September, we will have 82% of our population fully vaccinated. And this 82% includes the children under 12 who are not eligible. So if we just take into account of eligible persons in the denominator, almost 90% of our eligible population will be fully vaccinated, which is quite remarkable. And I really want to thank everyone for stepping forward to protect yourself, your family, as well as to protect others. And we have made significant progress in vaccinating seniors. By early September, 89% of our seniors aged 60 and above will have received 2 doses of vaccines. On this note, I'd like to thank everyone who has answered my call for more volunteers to help out with the home vaccination scheme for homebound seniors. So since 6 August, which is when I put up a Facebook post to call for volunteers, about 200 doctors and nurses have signed up with the SG Healthcare Corps. So as a result, we used to have 11 home vaccination teams. Now we can increase it to 33, 3 times. So hopefully that will bring down the waiting times significantly, and I really thank the volunteers for stepping forward. With a high vaccination rate, with a current high vaccination rate, our vaccine operation is increasingly moving to a retail mode. That means going out through the mobile teams, through the home vaccination teams. And the overall vaccination numbers have fallen to around 20,000 a day, and that is a quarter of what we used to do at the peak, which was 80,000 a day. So we will progressively consolidate the vaccination centers to fewer, reduce the number of vaccination centers. So residents, you will get your community club facilities back shortly. But we still need to keep a good number of vaccination centers operating for 3 purposes. 1, to vaccinate the rest of the population that has not been vaccinated. 2, after we have properly studied the safety and efficacy aspects, the vaccination of children below 12, which should start sometime in early 2022. And the third is to administer boosters. Now let's talk about booster shots. Israel has started administering boosters to their seniors and vulnerable persons. UK, Germany, and France have announced that they will start in September. The US CDC has just recommended booster shots after 8 months from the second dose. We will very likely have to start a booster exercise. And these countries started vaccinations earlier than us, and we therefore now have the advantage of observing them and learning from their experiences. Our expert committee, EC19V, is actively working on our booster program. The chairman is Professor Benjamin Ong, and he just briefed me, and he said there are 2 key things we need to find out and learn from the other countries that have started it before they finalize their recommendations. What are these 2 things? The first is the incidence of adverse reactions. Will it be as low as the first and second dose, or higher? And if it's higher, what are the steps that we can take to mitigate or remove the risk? That's number one. Number two, should we go for the same vaccine or a different vaccine? And we call it a homologous or heterologous strategy. And there is scientific basis to suggest a heterologous strategy may confer stronger protection. So the UK is implementing such a strategy, and we will be monitoring the outcome closely. And in Singapore too, we have not a small group, quite a sizable group of people who took the first shot of mRNA, found out that they are allergic to it, and therefore complete their vaccinations using Sinovac. So we too, the EC19, will be closely monitoring their immune response. But one thing which the EC19V is very clear on and will recommend is that we will proceed to administer a third shot for patients who are severely immune compromised at the time of their first two doses. Who are they? Some examples are patients who are on cancer treatment, transplant patients, other patients on immunosuppressive therapy, and end-stage kidney disease patients on dialysis. And because of their conditions, these persons, they react much less to vaccination, even after two doses, meaning they cannot produce as much antibodies or activate the necessary mechanisms to fight the virus. Hence, a third dose of vaccine is necessary for them. So the EC19V will be putting out their recommendations on this group shortly. And finally, let me talk about our health protocols. We have been making adjustments to them as we transit to living with COVID-19. And this is a key reason why we call this phase the preparatory stage. So what are the things we did? We started to allow fully vaccinated individuals who are exposed to the virus and issued QO, quarantine orders, to opt for home quarantine. Today, 80% of our community cases go into home quarantine and 20% in dedicated facilities. Second thing we did is we moved more infected persons who are fully vaccinated to community care facilities instead of hospitals. Today, 65% of community cases are in such community care facilities and 35% in hospitals. Both initiatives are working very well, which means our hospitals and the whole pandemic management capacity is less likely to come under severe stress. And we will now make a next crucial move in healthcare protocols. This is in consideration that over 98% of infected persons who are fully vaccinated have no symptoms or display mild symptoms. And it makes sense to step them one notch further, from community care facilities to home recovery. And it is not a new concept. Countries like Australia, Canada, UK, they have done so, and quite successfully. And we have been a lot more cautious, but now that the great majority of our people are fully vaccinated, we should also take a step in this direction. So we will implement a home recovery scheme as a pilot for a small number of households at the end of this month, August. We will put in place a robust monitoring and support system to make sure the individual stays at home and also receive adequate medical support. Family members, they are all required to be fully vaccinated and also quarantined at the same time. So if we want to live with COVID-19 as an endemic disease, this is a crucial step to take. It will further free up hospital capacity, enable our healthcare system to revert to peacetime operation, and attend to the healthcare needs of our population. So let me now hand the floor to DMS to elaborate on the details. Thank you.
Thank you very much, Minister. Mr. Ong has shared the reasons why we are embarking on a home isolation pilot. We had previously been admitting all cases who were diagnosed to have COVID-19 infection into either our acute hospitals or our community care facilities. And these individuals would only be discharged back into the community from isolation if we deemed that they were making a good recovery and were no longer infectious. Our high vaccination rates has allowed us to review our treatment and care model for COVID-19 patients. And with more local and global data showing that fully vaccinated COVID-19 infected individuals have a much lower risk of developing severe disease, we are now piloting a home-centric model for the management of COVID-19 patients with mild or no symptoms. These individuals require minimal supportive care and are suitable to be cared for in settings beyond the hospital or our CCFs. And this will allow the hospital's resources to be redirected to caring for those who are more frail and vulnerable to severe infection, as well as a worse outcome. As Minister has shared, home isolation is not a new concept. And there are many other countries, including Australia, Canada, Israel, the UK, the US, Thailand, who have allowed well but infected individuals to isolate at home until they recover from their infection. The WHO has also endorsed this approach in its guidelines on the management of COVID-19 infection. We are adopting a risk-calibrated and phased approach in implementing this pilot with the intent to ensure safe and effective isolation of COVID-19 infected individuals while preserving the safety of household members, neighbors, and the community. Only fully vaccinated individuals who are either asymptomatic or have mild symptoms are eligible for this pilot. They must first be assessed to be unlikely to deteriorate or require hospital-based care during their illness. And this is to ensure that it is safe for the individual then to recover at home outside the setting of both the hospital or the CCF. The infected cases must not belong to any vulnerable group which has an increased risk of a more severe infection. And this then excludes those who are 60 years or older, immunocompromised, have concurrent severe chronic medical conditions, or who are pregnant. We will be assessing each individual case to determine whether the home environment is suitable for home isolation to take place. The infected person must self-isolate in a room which has an ensuite bathroom or must stay alone at home. And this is so that others are not exposed to infection by sharing common facilities at home. And there's then no risk of infection spreading to neighbors. If the infected person self-isolates at home, but with other family members in the same home, these other family members must be fully vaccinated and well. And they should not themselves be vulnerable to getting a severe illness in the event that they do get infected. They will be subjected to home quarantine and regular, if not daily, ERT testing for early detection of infection in them. There will strictly not be any physical mixing allowed between the infected person on home isolation and others, whether living in the same household or visiting. The infected person will not be allowed to leave his or her home except for the purpose of a medical review with the approval of MOH. And to ensure with the movement restrictions beyond the home, the infected individuals will need to wear tracking devices similar to that used for persons on quarantine. Surveillance checks may also be performed through phone calls or visits. The cases will be selected for home isolation after an initial period of monitoring and evaluation in the hospital or the CCF. He would then be required to stay in isolation until he completes at least 14 days from the start of his illness, and he must complete an exit PCR test to demonstrate that he is no longer infectious before he is allowed to leave home isolation. If the PCR test continues to show the presence of virus at high loads, suggesting that he remains infectious, he will then be required to continue isolating at home for at least another 7 days. There will be other PCR testing requirements conducted during the course of this home isolation, including a day 9 PCR test, to ensure that these individuals are safe to come out of isolation. COVID-19 patients will be closely monitored during this home isolation period for their health and safety. And they will be provided access to telemedicine services if they require medical assistance. And this allows us then to pick up these patients if they're not feeling well, and if needed, to bring them back into the hospital setting for further evaluation and further treatment. We will start the pilot on the 31st of August, the end of August, and we'll continue to monitor the pilot's outcomes in order to inform if more patients may benefit from this mode of recovery in a safe manner at home. Thank you.
Good
Thank
evening.
you, Minister Suntianes. Oh, sorry.
I want to thank everyone in Singapore once again for cooperating with all the measures. By working together, we have been able to stabilize the infection situation, even as we eased measures on 10th of August. And therefore, we are able now to continue with our next step of easing starting today. That means that up to 50% of those who are able to work from home can return to the office. We will increase event sizes to 1,000 attendees if all of them are fully vaccinated persons. And we will increase capacity limits for malls, public venues like museums and libraries, as well as attractions. And we will also take careful steps to adjust our healthcare protocols, as you heard just now, and to reopen our borders starting next month, which Minister Iswaran will elaborate on shortly. But we should be under no illusion that the road ahead will be an easy one. The path towards being a COVID-resilient nation is going to be a long and hard slog. Even with very high vaccination rates, we are not going to reach herd immunity where the outbreak just fizzles out. Instead, we must be mentally prepared that cases will rise as we resume more activities and reopen our economy. So we will have to deal with more clusters. We are in a better position to do so because of our high vaccine coverage. It means that most of the cases will be mild, and we should be able to keep hospitalization and ICU cases low. But we have to remember that there are still unvaccinated persons amongst us. Even if we were to reach a vaccination rate of 82%, which will happen in a few weeks' time, that means 18% of the population are not fully vaccinated. That would include seniors who are very vulnerable. It would also include children who are not eligible for the vaccine. Now, the evidence is clear that the majority of children who are infected will end up with mild illnesses. But majority is not 100%. There will still be a few who end up being seriously ill. So if you have a large outbreak, hundreds of cases a day, or even more than 1,000 a day, invariably you will have amongst that group children who are seriously ill. You see this in other countries, like in America now, where the pediatric wards are filled with COVID cases. And this is why we cannot afford to take the risk of opening up in a big bang manner. Instead, we are doing this in a controlled, step-by-step manner. As the saying goes, we are feeling the stones as we cross the river. Each time we make a move, we will monitor the data, we will look at the evidence, ensure that our hospital system is able to cope with the infection situation before we take the next step. And from time to time, if we were to assess that a cluster has broken out, which potentially has the possibility of having widespread transmission in the community or overwhelming our hospital system, we may have to slow down the pace of reopening or even pull back some of the measures. For the past 19 months, we have been able to manage this pandemic effectively while keeping our hospital system intact and minimizing fatalities. And that remains our overall aim, to get to the end of this pandemic with minimum death and damage as a society, even as we seek to resume as much of our normal lives as possible. Just hand the time now to Minister Iswaran.
Sorry, let me just say a few words in Mandarin. 让我谈一谈，我们为年长者接种疫苗的一些进展报告，向大家报告一下。现在年长者有大概2组，还没有接种疫苗。第一就是担心身体不好，所以他们需要看医生，通过医生的劝告过后，检查好身体，说他们可以继续的打疫苗，他们才会放心的打。所以前几个星期，许多医生都帮这些年长者预约，见了他们，劝他们可以打疫苗。很多年长者就因此前去打疫苗。另一部分的年长者就是行动不方便，不能出门，到接种中心去打疫苗，所以我们需要我们的这个居家接种团队登门拜访，替他们接种疫苗。但是供不应求，我们一共有11组这个居家接种团队，但是需求很多，要等居家接种疫苗要等8个星期左右。所以在8月6日的所以在前一阵子我就在网上号召，希望有更多的医生跟护士前来帮我们做义工，自愿的帮我们去进行这个居家接种疫苗。很高兴的就是8月6日到至今，大约有200名医生和护士响应了我们的号召，加入了我们的志愿团队。所以我们的队伍从以前的11支，现在已经有33支，希望这能够大量的减少年长者等候的时间。而所有的年长者呢，他们接种疫苗的这个发现率有明著的进步到了9月初呢，就是下个月初呢，年满60岁的年长者当中，我们预期89%将完成2剂接种，所以我们也感到非常鼓励，也很感谢所有的年长者，还有他们的家人，鼓励他们前来接种疫苗，保护自己，也保护家人。所以希望大家再接再厉，所有的安哥安弟、阿公阿嬷、巴吉马吉，谢谢大家。希望大家跟朋友亲戚讨论过后，继续的鼓励你们的朋友亲戚前来接种疫苗，让新加坡走向一个能够跟病毒共存安全的社会。谢谢。
Swaran.
Good afternoon, members of the media. Thank you for joining us. On 24th March 2020, Singapore closed its borders to the rest of the world. We did this to curb the spread of COVID-19 and to save lives. But we also knew that such a sweeping and unprecedented move would profoundly disrupt our economy and also our status as an aviation hub. And since then, we have made a series of careful moves to reopen our borders. For very low-risk countries and regions, we have unilaterally opened to allow general travel with an on-arrival PCR test. About 33,000 visitors have arrived from these countries and regions over the past year. We also have travel lanes for specific purposes, such as the reciprocal green lanes, for essential business and official travel. Other than these, our borders are still essentially closed to all general travel. So families have not been able to see each other, and leisure travel is not possible. This has also exacted a heavy toll on the aviation sector and the adjacent industries. which employ more than 190,000 people. Changi Airport is only at about 3% of its usual pre-COVID-19 passenger volume. The number of passengers SIA carried in June 2021 is just 4% of that in December 2019. Related sectors, including aerospace, tourism, and hospitality, have also been badly affected. Our aviation workers have made many adjustments and sacrifices to keep our borders open for essential supplies and for Singaporeans to return home. And we are deeply appreciative of their commitment and efforts. But the current situation is not sustainable. As a small and open economy, Singapore's survival and success depends critically on being open and connected to the world. The MTF co-chairs have outlined how, enabled by the vaccination rates in our population, we are making the transition towards a COVID-resilient nation. We are reopening in a careful and calibrated manner, striking a balance that will protect lives and livelihoods. And that is the same approach that we will adopt to the reopening of our borders and the resumption of air travel. Careful, calibrated, step by step. We will continue to be guided by our public health assessment of a country's or region's COVID-19 situation, including their infection rate and vaccination coverage. This is also the basis for the risk-based categorization of countries and regions and attendant border measures, which Minister Gan has mentioned. To quickly reiterate, it starts with allowing travelers to enter with just an on-arrival test for Category 1, a 7-day SHN for Category 2, and a 14-day SHN for Categories 3 and 4. In the transition towards COVID-19 or COVID-19 resilient nation, we need to augment these border measures with new modalities to reopen travel safely. Therefore, as a next step, we will introduce vaccinated travel lanes. We will start with 2 countries in Category 2, Germany and Brunei. And let me explain further. With effect from the 1st of September, we will allow any traveler from Germany who is fully vaccinated to apply for entry into Singapore under the vaccinated travel lane. This is open for general travel. So it's not confined to business or official. It is open for all general travel. Approved VTL travelers can enter Singapore from the 8th of September onwards. Those based in Singapore who travel to Germany may also return to Singapore under the VTL. So, because Germany is already open to travelers from Singapore, the VTL will restore two-way, quarantine-free travel between our 2 countries. To qualify for the VTL, travelers must be fully vaccinated in either Singapore or Germany. An individual will be considered fully vaccinated 2 weeks after receiving the full regimen of a COVID-19 vaccine under our national vaccination program or any COVID-19 vaccine in the World Health Organization's emergency use listing. We will require those who have been vaccinated in Germany to present proof so that we can verify their vaccination status as part of the entry process. Travelers must have remained in either Singapore or Germany for 21 days prior to departure. VTL travelers from Germany will not be subject to Ascertain. However, they will be subject to a rigorous testing regime. First, they will need to present a negative PCR test result taken 48 hours before departure. In Singapore, they will have to take an on-arrival PCR test and be required to self-isolate while awaiting their test result. They will also be required to take 2 PCR tests on the 3rd and 7th day after arrival. For a start, there will be 1 daily designated flight for VTL travelers from Germany to Singapore. So in aggregate, that would mean about 2,000 travelers if the VTL is fully taken up. As Brunei has been reclassified into Category 2, the current unilateral opening arrangement for travelers from Brunei will cease on the 20th of August. The visitors from Brunei can continue to apply for essential travel to Singapore through the current reciprocal green lane. In addition, from the 1st of September, we will allow fully vaccinated travelers from Brunei to apply for entry into Singapore under the VTL. The same conditions as that for the VTL with Germany will apply. For a start, there will be 3 designated VTL flights per week. The vaccinated travel lanes with Germany and Brunei mark a measured start to the resumption of air travel with an essential set of safeguards. We have chosen to start with these 2 countries based on overall risk and operational assessments. CAAS is working with all partners, including airlines, Changi Airport, and other government agencies, to gear up for the vaccinated travel lanes, including putting in place the required testing regime. This will allow all stakeholders to run in their processes, learn from the experience, make further enhancements before we consider possible extension of the scheme. Let me now turn to Hong Kong. As you would be well aware, Singapore and Hong Kong have been in discussion on an air travel bubble since last October, when vaccinations were not yet available. The progenitor of it is sitting beside me here from the Singapore side. Unfortunately, we have not been able to launch the ATB due to the surge in community cases in both our cities at different points in time. In Singapore, a substantial proportion of our population is now fully vaccinated, as you've heard. Hong Kong, too, is progressively vaccinating its population. Both sides are focused on keeping our population safe and minimizing the risk of imported cases. But our strategies differ, with Singapore now taking steps towards becoming a COVID-resilient nation. Against this backdrop, my Hong Kong counterpart, Secretary Edward Yao, and I have discussed and concluded that we will not be able to launch or sustain the air travel bubble in its present form. We remain committed to facilitating travel between Hong Kong and Singapore. We are both financial and aviation hubs with close economic and personal ties, and it's important to re-establish general travel between Hong Kong and Singapore so that our people and businesses can reconnect. In this regard, earlier this month, Hong Kong announced revisions to its overall border policies, and this includes a shorter quarantine period for vaccinated travelers from Singapore. On our part, Singapore will unilaterally open to visitors from Hong Kong, which is in Category 1. Similar to visitors from other very low-risk countries and regions like mainland China, excluding Jiangsu Province, New Zealand, and Taiwan, visitors from Hong Kong will be allowed to enter Singapore with just an on-arrival PCR test. We will also extend this unilateral opening to visitors from Macau, which is also in Category 1. Visitors from Hong Kong and Macau will be allowed to apply for entry with immediate effect for entry into Singapore a week later. So let me summarize what all this means for our travel landscape. First, Ministry of Health has established a risk-based categorization of countries and regions with attendant border measures. This is the baseline setting for all travelers and the foundation upon which we will assess further reopening moves. We commenced last year with unilateral openings to very low-risk countries and regions. We now add Hong Kong and Macau to this list. With this, we would have allowed general travel from all Category 1 countries and regions, subject to an on-arrival PCR test. We will augment this framework with the launch of vaccinated travel lanes for Germany and Brunei. This is a new modality in our reopening, which has been enabled by the progress in vaccination in Singapore and other parts of the world. We will implement the vaccinated travel lanes cautiously. We are starting with 2 countries with designated flights and a set of essential safeguards. This will allow us to learn from the experience and enhance our processes before any further expansion of the scheme. I know that some Singaporeans would want us to move faster on the vaccinated travel lanes. I also know that others may be concerned about the risks of such reopening measures. To those who want to do more, I ask for your patience. At this juncture, it is more important that we get it right than that we do it fast. The experience gained from implementing these initial moves safely will enable us to later extend the scheme with confidence. To the Singaporeans who are concerned, I seek your understanding. We are moving in a measured manner, starting small with 2 countries and an essential set of safeguards. The safety and well-being of our people will always remain our utmost priority. We will not throw caution to the wind. Above all, we seek the support of all Singaporeans for these measures. As an open and small economy, our connectivity with the rest of the world is essential, if not existential. That is why we need to start reopening. The longer our borders remain closed, the greater the risk of lasting damage to our economy, our livelihoods, and our status as an aviation hub. We will continue to take a cautious, calibrated, step-by-step approach to reopening our borders, always mindful of our public health objectives. And we are fortunate to be embarking on these moves with more than 75% of our population fully vaccinated. Ultimately, we want to safely and progressively reopen our borders and resume air travel to build public confidence and ensure that these arrangements are sustainable as we journey towards a COVID-resilient nation. I hand you back to Minister Gan.
Thank you. I'll now invite questions from the media.
Members of the media, we will now begin the Q&A segment. Please remember to unmute before asking your question. Please also note that we will only take 1 question per media so as to allow more to participate. Thank you. For the first question, we have ST Timothy Goh.
Thank you, Ministers and DMS. Could we please get an idea of when group size and dining in limits may be raised further? Or will we now be slowing down our reopening because we're planning to let more travellers in? Thank you.
Thanks, Timothy, for the question. We have a roadmap in terms of our reopening plans. It's comprehensive. It covers border measures. It covers community measures as well, including group sizes. So today we are talking about mostly border measures, but also some community measures which we had announced earlier, and we are proceeding. We continue to review as part of the roadmap, and in due course, we will update on community measures, especially as we enter the transition stage of our opening. Remember, we are now in preparatory stage. We had done it in 2 phases, and as we enter the transition stage of reopening, we will be reviewing and updating on the possible relaxation of community measures at that stage.
Thank you, Minister. For the next question, Simin from Zaobao.
Hi, Ministers and DMS. Thank you for the sharing earlier. So I would like to ask, now that we are reopening our borders, right, what are risks of imported cases increasing, and how will we be managing this risk?
I think your question, I thought, is basically how are we going to manage the risks as we reopen our border. As I want to start by emphasizing again that our starting position is the assessment that we have from Ministry of Health, the risk-based categorization of the various countries and regions, and what would be the base setting of our border measures. That, I think, is an important part of the architecture because it takes stressing from the overall national posture that the MTF has established for the way we are managing COVID-19 and the transition to a COVID-resilient nation. Secondly, for the specific initiatives we are undertaking, for instance, here today in the context of the vaccinated travel lanes for Germany and so on, we start with the selection of the country. As I said, the selection is based on an assessment, overall assessment of the risk and operational matters. Second, we have put in place ex ante measures, minimum 21 days stay, they must be vaccinated, 48 hours pre-departure PCR test, which must be negative. Then, when they arrive in Singapore, we will have the on-arrival PCR test plus a PCR test on day 3 and day 7. So those are all important markers because it allows us to track. There are people the travelers who come in will also have the Trace Together app, and there will be CAAS working with all the government partners will be monitoring their compliance with the testing. And if there's an untoward outcome where someone is proven to be positive, our ability to then respond through the tracing mechanism to then control the impact is also an important part of the risk mitigation. So it is this composite, starting from the national posture, the broad architecture for our travel, border measures, then the specific initiatives with respective countries and the key provisions, safeguards that we are putting in place, and the follow-up through operations and execution. It is this composite that will basically help us mitigate the risk that you've identified.
I should add that this is also one reason why we are taking a very cautious and calibrated approach. I think Mr. Iswaran explained just now that there are some Singaporeans who are asking why can't we open faster, extend to more countries and open up the window bigger. That is one reason why we need to do it very carefully so that we are able to calibrate our measures as we go along and we learn from this pilot project. And if we are able to do so safely, without seeing a major surge in a number of cases in the community, then we will be able to open it in the next steps.
One additional data point, you will notice that for Germany, for example, we have only designated 7 flights. In aggregate, between Germany and Singapore, per week, we have 28 flights. So again, that is another control points, so in terms of the numbers as well. And these give us various levers to then flex up or down depending on the situation and assessment of risks.
I should add just one more layer of defense, which is we are 77% fully vaccinated. So choose a safe country, make sure everyone is fully vaccinated, control the numbers, test before, after, during, and we ourselves, 77% fully vaccinated. That's how we control the risk.
Thank you, Ministers. For the next question, we have Hui Min from CNA Digital.
Thanks for taking my question. So, keeping in mind what happened twice with the Hong Kong travel bubble, my question is: will the travel arrangements with Germany and Brunei be subject to last-minute suspensions similarly? Or are they going to continue irrespective of, say, fluctuating COVID case numbers either in Singapore or Germany and Brunei? Thank you.
I can understand the sentiments behind your question. However, these vaccinated travel lanes are materially different in the way they are developed compared to the air travel bubble with Hong Kong, previously discussed. Because the ATB was a bilaterally negotiated process to arrive at an arrangement that both sides could then sign off on and move forward. In the case of the vaccinated travel lanes, these are actually moves that we are making. It is completely within Singapore's jurisdiction and control in terms of the measures and the moves. So in the case of Germany, for example, they have already opened travel for Singaporeans to go into Germany. What we are now doing is reciprocating, as it were, in part by introducing this vaccinated travel lane, and the measures that we are putting in place are all from Singapore. I've had a discussion with the German minister who welcomes this initiative, and he thinks of it as a potential model as to how travel can resume systematically and safely. Similarly with Brunei, we had a unilateral opening to Brunei, and now we are moving to a vaccinated travel lane with Brunei, and these are again within our control. So the short answer to your question is that this is not a case where the situation might change because of circumstances, and therefore we pull the plug on the VTL.
Thank you, Minister. The next question, we have Chen Lin from Reuters.
Hi, good afternoon all. So my question is, what are the COVID-19 protocols for foreign dignitaries, such as for the US Vice President Kamala Harris and her team, which will be visiting Singapore this weekend? And also, Singapore's announcement on Germany today seems very, very cautious. 4 PCR tests required in total. What is stopping Singapore from opening a bit more daringly, given that government has said this is an endemic and we need to live with it? Thank you.
We couldn't get the second part of the question. Can you repeat the second part?
You mean the second question?
Can you perhaps speak a bit slower and into the mic so that we can hear you clearer?
Okay, so my first question is, what are the protocols, COVID-19 protocols for the foreign dignitaries, such as for the US Vice President Kamala Harris and a team which will be visiting Singapore this weekend? And also, considering Singapore's announcement for Germany today seems very, very cautious. 4 PCR tests required in total. So what is stopping Singapore from opening a bit more daringly, given that the government has said there's an endemic that we need to live with? Thank you.
Okay, I'll take the first one, and Minister Iswaran will take the second one. Of course, we are very glad to welcome US Vice President Kamala Harris to visit Singapore. It's one of the 2 stops that she will make in Asia, her first trip out in Asia. And the US is always a major stakeholder in Southeast Asia and Singapore, and we very much welcome, and I'm honored that she has made Singapore her first stop in her first trip out to Asia. Her visit is not it's also not the first time a foreign dignitary has visited Singapore. So in the past, we have other dignitaries, and we subject them to similar healthcare protocols. It would not be practical to subject foreign dignitaries to SHN, because then I don't think they will visit Singapore. So instead, as a principle, we know that we can always replace SHN with tests. Technically, if you test every day, the person, so long as it's negative every day, you know that it's safe for the person to move around. Except that we can't do that for the entire population, and therefore, SHN and quarantine is often the other way for us to implement a nationwide healthcare measure. So in the case of the Vice President's visit and the delegation, it will be subject to frequent testing, itinerary that is restricted to areas that are safer, that the delegation will not come into contact with, for example, many seniors, such as a home, for example. So all this is out of bounds in the itinerary. So with a controlled itinerary plus regular testing, we can keep such a visit safe.
So your question is, why are we being so cautious with 4 tests? Well, I think in a way, the answer is in your question. It's because we want to be cautious. This vaccinated travel lane is a new scheme. We want to make sure that we start right. Make sure the parameters work. We are able to minimize the risks of any imported cases to the best of our ability. And this is not a mean feat, because it does require everybody, all stakeholders along the entire value chain, from the traveler to the airline, to the airport, to then the domestic aspects in terms of transfer, and to whether they're staying in a hotel or in a home, compliance with the SHN, and remaining self-isolated before the results come out. There's a whole series of these things. And we need to ensure that the systems are in place, they work, and most importantly, that they achieve the outcomes that we believe they will. Once we are able to do that, then we can proceed with greater confidence to scale up and expand the scheme. But I think at this very initial stage, we would be well advised to ensure that discretion is the better part of valor.
I thought it's useful just to make an additional point, because the question that's raised can be asked of any of the measures, whether it's border measures, whether it's community measures, group sizes, F&B restrictions. The broader question is, well, we have such a high vaccination rate, why not declare Freedom Day and just do everything that everybody wants to do? Well, some countries may choose to do that, but Singapore has to decide on its own path. Risk tolerance and risk attitudes will differ from country to country. Some also have gone through very large outbreaks previously, and so they have a different perspective about the matter, recognizing that they, because of the very large outbreak previously, they would have a much higher level of underlying protection amongst their population too. Well, we have had a different experience through the past 19 months. We have kept infection rates generally low, fatality very low, and we have been able to raise our vaccination coverage. So our attitude towards reopening, as I said just now, is one where we take a controlled, step-by-step approach, recognizing that each time we open up, be it on the community front or in terms of border opening, we are taking on more risk. Cases will go up. There may well be more infection, more clusters to deal with, which is fine because we have a higher vaccination rate, but we just want to ensure that hospitalization and ICU outcomes are kept low. We want to get through this pandemic with minimum damage and minimum death toll while trying to resume life as normally as we can. And that's the underlying philosophy behind our sequential, controlled, risk-based approach.
Thank you, Ministers. The next question from ARD German Radio and Television. Sandra, please.
I have a question with regards to the vaccinated travel lane. What about under 12-year-olds? Will families where the parents are vaccinated be able to board one of those designated flights, or are they not allowed to do so?
Sorry, so your question is if you have members of the family who are not vaccinated and others who are vaccinated traveling together? Is that what your question is?
Yes, if you have a family with under 12-year-olds, they can obviously not be vaccinated.
So the current arrangement is that children under 12, because they are not vaccinated, they will not be eligible to travel under the vaccinated travel lane. But there remains the option for the family to come back on one of the other flights back from Germany. And as you have heard earlier, with the current framework that we have in place, the family can also apply to do their SHN at home. So that would be the option available. We will review this as we go forward, but right now, that is the risk posture that we have.
Thank you, Minister. The next question, we have polling from Channel 8 News.
Hi, Ministers and DMS, polling from Channel 8 News here. My question is in regard to the 7-month prayer, so I will ask in Chinese. 那么想请问部长，就是之前道教总会有提到说，希望可以就是在中元节的时候恢复，就是按照婚宴的模式来恢复举办晚宴。就是中元节的活动，包括海标。那么不知道现在的进度是怎么样的？因为据我们了解，好像当局是有在考虑说，可以在有条件的情况下，允许30人的活动这样子。那么因为这个来临的星期天就是农历7月15了，所以不知道部长现在是可以证实这一点吗？还是安排是怎么样？那么批准或不批准的原因啊，还有考量是什么呢？谢谢。
I got the eye power today. 你要我用华语回答是吗？是吗？是哈。有一些细节我可能还不大记得，这个要给这个社区发展部逐步的去宣布。但我们的概念是这样，现在项目呢可以增加到500人是吗？500 right? The event size is 500.
Vaccination is 1,000. Fully vaccinated.
如果完全接种了疫苗是1000人，就是今天过后，没有接种疫苗呢就是50人。所以中元节要坐下来1000个人一起吃饭，那是不行啊，那是不行啊。但是如果我们所说的项目可以有1000人，是表示1000人可以坐着没有循环，而且口罩戴着，没有堂食的这种情况下，可以增加到1000人。所以在教堂，在回教堂，我们的就可以有1000个信徒一起祈祷。所以中元节也是一样的道理。如果说要有一个晚宴是不行，但是要有一个项目可以继续的招标，大家坐着戴着口罩，这个是可以进行的。详情呢，我们让社会发展局继续的去宣布。I will summarize response in English. Okay. The question was, we are into the 7th moon of the Chinese calendar. This is what we call the ghost month. And traditionally, we will have banquets in the community with lots of auctioning activities during the banquet. Of course, such big events where people gather, mask off, and have a meal, that is not possible under today's circumstances and under today's safe management rules. But from 19th of August, we have increased our event size to 1,000 for all vaccinated participants, provided too that they are seated with spacing, mask on, and no food. So religious services is one good example. And so mosque, church, services can go up to 1,000 fully vaccinated participants. So in the same logic, we can have 7 Moon Festival gatherings, provided these conditions are met. So there will be no dinner, no food, but participants can be seated, mask on, and participate in auction activities. Of course, the auctioneer will have to be tested, vaccinated, to make sure that he is safe. So there are some details that I think we'll let MCCY announce in due course.
Thank you, Minister. For the next question, we have Jolene from Shinmin Daily News.
Hi, good evening, ministers and DMS. Okay, I understand that we are not going to open anytime soon with a big bang, and then group sizes might also increase gradually. But I also understand that Minister Wong did mention before that wedding receptions and banquets are once in a lifetime. So we'd just like to ask if there's any possibility for wedding receptions to have any exemptions to include more guests per table beyond the 5 per table right now.
Thank you. These are things that we continue to monitor and review. So as of now, for wedding receptions, the rule is 250 attendees if they are all vaccinated and in a group of 5, so 50 times 5. We are not making any change in this second stage of easing because, you know, when people are gathered together, whether it's for 7 Moon or whether it's in a wedding reception, when they are gathered, mask off, eating, it is going to entail quite a bit of risk, and that's why we are concerned. So we are not making any move now, but as I answered just now, I think it was Timothy who asked the question, the measures are not static, right? We are on a journey toward reopening. We take small steps with community measures. We have done so earlier and today. We are taking a small step forward for border reopening, which begins in early September, and we will continue to review sequentially on the community front as well as with regard to our border measures. And we certainly will bear in mind the considerations of wedding couples who would like, I'm sure, I understand, to have a larger gathering and to have more people around the table.
The next question from Gwyneth, Channel News Asia.
Hello, hi. Can you hear me clearly? Yes, right? Okay. My questions are basically about the new healthcare measures that are being put in place. How quickly can we expect booster shots for the general population in Singapore? And also the move to allow those who are already vaccinated to to recover at home. How much will this move free up the healthcare system, but would it not tax resources more to ensure the compliance of these patients? Thank you.
Thank you very much for your question. I'll take first the question on booster shots. The expert committee on COVID-19 vaccinations is right now reviewing and finalizing its recommendations as to whether or not booster vaccination doses are required. As Minister has shared, there are many facets to this discussion and conversation. First of all, we want to ask ourselves whether booster vaccinations are required for the general population or whether we should prioritize a subgroup of people who have an increased risk of getting infections even after vaccination. For example, they may have not mounted an adequate immune response to the original full second 2-dose regime, or they have waning protection from vaccinations and therefore require augmentation of that immune response in order to give them further protection. So that's an issue that the expert committee is currently deliberating. We expect their recommendations to come out soon, and once that is released, we will make a suitable announcement concerning whether there is a plan for booster vaccinations to be provided. Once we have finalized that goal, we then need to work through the operational details, including what type of vaccine is provided, when that should take, and how that would be delivered. So we're working through some of these details in anticipation of the expert committee's recommendations, but we should wait for them to finalize their details and recommendations before we make suitable announcements. The second question relates to the home isolation pilot that we had just announced. We are working through the operational details as well, and that requires some adjustment or shifting of resources to enable us to have an ability now to support more patients in the home setting as opposed to in the community care facilities or hospital setting. So we are shifting some of our resources around to ensure that there's adequate support for these patients. And that also includes the resources required to track, monitor, and ensure that these patients follow the rules and properly self-isolate at home and not move out and continue to mix in the community. We have a lot of trust that those who we recruit onto the pilot will understand. We will be educating and properly explaining to them what is required and why it's important for them to follow the rules. And we have a high degree of trust and confidence that they will indeed do the right thing. But it's important to make sure that they first understand what their public health responsibilities are, and we want to make sure that we can properly support them to ensure that their safety is not compromised as they are in the home setting. But that sort of operational details are being worked through. We should be ready in time for the start of the pilot at the end of the month.
Let me just add a few points. Thank you, DMS. Booster shots, I suppose your readers and your audience will be very keen to know when will we start. So as DMS explained, give us some time, or give the expert committee some time to answer the two significant questions that I mentioned just now. But bear in mind this, Israel, Germany, UK, they started mass vaccinations from December last year, whereas we started only pilots, frontline, towards the beginning of the year. By the time we send out SMSs, invite the seniors to come forth to vaccination centers and embark on our national vaccination exercise, that was end February, early March. So the other countries started a good 2 to 3 months earlier than us. So it's also not surprising to see these countries starting with their booster shots first. In time, I believe the EC19 will come out with their recommendation to start our booster program. As for home recovery, let me also add, today we have 2 layers of recovery settings. One is hospitals, and second will be the CCFs, the community care facilities. What we are trying to add is a third layer, which is the home, which actually we can imagine makes a lot of sense. Because for a vaccinated person, over 98% have no symptoms or very mild symptoms, which means it's actually not very different from getting the flu. But if they take up a bed, whether at the CCF or hospital, you actually take up quite a bit of resources. If we can decant down to have a proportion, doesn't have to be 98%, just a proportion of that, at home, recover from home, it will free up. You will first free up CCF, more hospital cases can go to CCF, and then we will free up hospital beds as well. That will be a very meaningful enhancement of our healthcare capacity.
Thank you, Minister DMS. We have time for 2 last questions. For the first one, from Yahoo News, Cassandra, please.
Hi, thank you for taking my question. My question is pertaining the 9 deaths in August. So I was wondering how many of them are related to the Delta variant, and overall, of the number of deaths in Singapore, how many are from the Delta variant? This is also pertaining to a recent Reuters article that said that experts expect some 1,000 deaths in the next 2 years. Thank you.
DMS?
Thank you very much for the question. The deaths that we reported over the last few weeks were almost all related to the latest few community clusters, and they've all been, for those who've had phylogenetic tests done, they've all showed Delta variants. They're not all necessarily the same, but as a cluster evolves, sometimes you do see minor mutations taking place, so minor variations take place, but they all are related to the Delta variant we've picked up. So these deaths are not in individuals who are of other variants. You've asked the second question. I missed that second one. Oh, yeah. So all the deaths are Delta variant, those that we actually were able to perform phylogenetic testing.
Thank you. For the last question, we have Evgeny from TASS Russian News Agency.
Good evening. Thank you. My question concerning vaccinated travel line with Germany. As one of precondition is a person must spend 21 days in Germany before flight to Singapore. And as there is no border control in European Union, I want to understand how it's possible to verify that the person has spent this 21 days in Germany, not he is in Italy or France. Thank you.
So your question is, how will we ascertain the 21-day residence in this case, Germany, prior to departure? So the way the regime works is it's based on self-declaration, meaning the individual has to make a declaration to the effect that he or she has spent the last 21 days within Germany. And that declaration is being made to our authorities, and that's the basis on which it's like any other health declaration that is made, for example, in some of the border measures. And that is the basis on which they will be eligible for this vaccinated travel lane and entry into Singapore and all the attendant arrangements and privileges. If it is found that they have made a false declaration, then action can be taken against them, enforcement under the Infectious Diseases Act. It has various provisions for false declarations. But perhaps I should use this opportunity because it applies both to outbound travelers from Singapore going to Germany and then returning, as well as those who are coming from Germany back to Singapore. I would say that, and I would like to emphasize this, the system, we are designing it to make it as safe as possible so that we know how well it works and how well it can help us mitigate the risks that might arise from cross-border travel. Therefore, I would urge everyone involved to see them not as guidelines to be gamed, but as safeguards that need to be strictly observed for our collective well-being. I think if we can go on that basis, because enforcement, etc., is after the fact. What we really need is responsible participation and compliance with the scheme design. If that happens, and if all the stakeholders and travelers play their part, then I think we have a very good chance that the scheme can work and it can be scaled up.
If I may just clarify and add on to the answer I gave just now on the 7 Moon. So the MCCY have discussed with the Taoist Federation, and the rules that they have put in place is 30 packs in temples. So you can gather 30 persons in temples, and participate in auction events. So this is something that has been discussed at the sectoral level. If I may just repeat that in Chinese, 让我澄清一下刚才所解释的这个中元节的招标规则，就是我们的社区发展部跟道教总会已经磋商过了，他们决定呢，就是这些招标就是标的这个项目啊，是30个人，30个人可以参与，可以主办在这个庙宇里面，好，30个人，然后有这个招标活动。
That's the last question. Yeah, let me maybe bring this press conference to a close by saying that we have announced several measures today. One is on the travel arrangement. Secondly, on the healthcare arrangements, healthcare measures and protocol. These are significant moves to bring us closer to a COVID-19 resilient nation. And we have chosen to adopt a slightly different approach from many other countries. We have achieved a relatively high level of vaccination, as Minister Ong highlighted. By the same time, we are avoiding a major Big Bang opening. This is to help us to avoid a sudden surge in the number of cases as a result of a Big Bang opening, which will then put a stress on our healthcare system and may increase the mortality rate as a result. By taking this step-by-step approach, introducing measures one by one, that will allow us to open up our economy, move towards a COVID-19 resilient nation in a cautious manner, in a step-by-step manner, and keeping Singapore and Singaporeans safe. And this will also allow us time to make adjustments as we go along, as we learn from the experience, and this will allow us to continue our journey to open up in a safe way. But as Minister Wong highlighted, there's no guarantee that this will be a smooth sailing throughout our journey towards a COVID-19 resilient nation. There will be bumps in the way. There may be detours that we need to make. There may be bricks that we have to apply. And sometimes we may need to slow down or roll back some of the opening measures. We have to be prepared, and we continue to monitor the situation very carefully. And the key is to keep Singapore and Singaporeans safe even as we open up. So thank you very much for attending this press conference.
Thank you.
Thank you, Ministers, DMS, and members of the media for your time today. We have now come to the end of the virtual press conference. The time is now 6:34 p.m. The embargo is lifted. Thank you and have a nice evening ahead.